everybody. So the practice today is a breathing practice. So a breathing technique which you can use. It's accessible to all. Just go easy. If you have some breathing problems, just take your time. Do what you can. It's particularly good for asthmatics to prevent an asthma attack. And it's also good for COPD sufferers, so anybody can get involved in this. Great for expanding the lungs, and in particular for moving into the back of the lungs, which we don't often do, and the lower lobes of the lungs, which is where the most blood vessels are. The practice is called Pigeon breath. It helps to bring your awareness to the diaphragm, which is where we start the breathing process. Even though you think it's coming in through your nose or your mouth, it's the muscle of the diaphragm that starts the inhalation. And you can use this if you're feeling a little bit fraught, if you've had some exercise that's made you breathe quite heavily, or if you're breathing quite shallow at the top of your chest, just to deepen the breath, to settle the breath. It helps, of course, to settle the mind when you settle the breath. So think about anybody with panic attacks, anxiety, stress. All this is going to be great to help with that issue. So you can't actually see my feet. My feet are on the floor. Wherever you sit, and I'm just sitting on the sofa today, make sure that your knees are at a right angle. So if your feet are not going to touch the floor, then I suggest you use a cushion to raise the floor up. Knees at a right angle, and you're not sitting back on the sofa or the chair. You're keeping your back and spine nice and erect, and all in line too with your neck. So not off to one side or leaning. So you can do it sitting on the chair, sitting on the sofa, you can do it sitting on the bus. I know we're not going on buses much now, but you can, as long as you've got some room at the side of your body. You can sit cross-legged if that's how you like to do it. So just make sure that your spine's nice and upright. You've got plenty of space in the torso for this beautiful breath. Just to start off with, bring your breathing, your awareness to your breathing. Feel the breath as you inhale, raises the body slightly, and as you exhale, everything settles. So if you have had some exercise, just make sure your breathing comes back to normal before you start this breath. So you can either interlock your fingers, or you can just place one hand on top of the other, which is how I like to do it. Then you just take the chin and rest it on your hands, either interlocked or one on top of the other. The elbows quite near to each other, and your chin is parallel with the floor. Keep that spine nice and upright. I'll show you this and you might want to watch it first. It's a 4-part breathing sequence. Try and inhale through the nose if you can. Breathe in, open the arms. Breathe out, the chin's tilted up slightly. Through the mouth, with your lips pursed like you're breathing out of a straw. Elbows come back down. Chin slightly tilted, breathe in, a normal breath through the nose, and a breath out through the nose, let the chin come back to normal. Breathe in, open, tilt, breathe out through a straw, breathe in normally through the nose, breathe out, let the chin come back. Breathe in, open, breathe out through a straw. Breathe in, head is tilted, Breathe out through the nose, let the chin come back. So I'm just going to tell you a little bit about why we're doing these things. And it's all about where you're going to access the breath in the body. So this breath in really activates the diaphragm. Opens out the sides of the ribs and the lungs. The chin tilts up slightly. As you breathe out as if through a straw, it allows the diaphragm to settle and relax. Elbows come quite near to each other. Because of that, when you do this next in-breath, you're restricting the front of the lungs and you're moving into the back of the lungs and the lower lobes on your in-breath. Keep breathing. Breathe in. Breathe out. Breath in through the nose. Breath out through the nose. 4 ways. The first one, breathe in. Breathe out through the straw. Tilt the chin. Breathe in through the nose. Lower lobes are activated. Breathe out through the nose. Come back to the beginning. Keep that breath going to whatever your breath needs to be. Make sure the spine's staying upright. Push down with the tailbone. When you've had enough, just come back to normal. Let the arms rest, the hands rest in the lap. So just 2 more rounds. Last round now. Breathe in, open wide. Rib cage. Push through the straw, let the diaphragm relax. Chin tilts upwards. Breathe in. Through the nose, activate the lower lobes of the lungs. Breathe out normally through the nose and let the chin come back to parallel. Let the hands come down into your lap. Close your eyes for a moment. Let the breathing just come back to normal. And I think you'll find that despite you were giving some energy there, that the breathing hasn't got out of sorts. You're not struggling for breath, but you've really worked into the intercostal muscles, the diaphragm, the whole of the lungs, the lower lobes, the mid and the upper. You've helped settle the mind because you were concentrating on this 4-way breathing. Maybe any stresses or worries that you had just disappeared for those few moments. So it's a great exercise that you can do anywhere, at any time of day. You can do it before sleep. You can do it on waking. Do it sitting at your desk. Lots of people working on their laptops at the moment. It just gives you a nice little breather, pardon the pun. And just try and increase that practice and you'll find that it gets easier and you find some strength coming into these muscles, supporting the back and supporting the breathing apparatus. And you might just enjoy the time with you and your breath and your body. Okay, enjoy the rest of your day. Thank you.